Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I'm really struggling with this weakness. Ever since my last hospital stay, I haven't felt the same. I've been on dialysis for about 7 years now, but these recent issues feel different. Even with the walker, I just can't seem to get around like I used to. It's frustrating.
I understand your concerns. It's important for us to look at all aspects of your health, especially after your recent hospitalization. Can you tell me more about your current symptoms and how they are affecting your daily life?
Well, besides the weakness, I've noticed I get tired very easily. I can hardly do a few steps without having to sit down, and with the home rehab exercises, I try my best, but I feel like I'm not making much progress. It's like my body just isn't responding.
That sounds quite challenging. How about your eating and sleeping habits? Any changes there?
My appetite isn't great, and I find myself not wanting to eat much. I've been sleeping okay, but I wake up feeling just as tired as when I went to bed. I'm also worried about the anemia. My hemoglobin hasn't been great, hovering around 9 to 10, despite the transfusions I had during my hospital stay.
That is concerning, especially since your energy levels and ability to recuperate are directly affected by your hemoglobin levels. We need to keep an eye on that. How are you managing your medications with all these changes?
To be honest, it's been a bit confusing. There have been several adjustments, especially with my blood pressure medications. I think the dosage of amlodipine was increased last time. It's a lot to keep track of, and sometimes I'm not even sure if I'm taking the right amounts.
Managing multiple medications can definitely be overwhelming. We'll review all your medications today to make sure you are on the right track. It's also important that we continue to monitor your blood pressure closely, especially with the recent changes in medication.
Yes, and about the dialysis, I've been going on schedule, but sometimes I feel really drained afterwards. The staff at the center are doing their best, but some days are just harder than others.
Dialysis can be taxing on the body. It's good that you're maintaining your schedule, but we need to ensure it's as effective as possible without draining you further. We might need to consider adjusting your session durations or frequencies based on how you're responding.
I also spoke to my rehab therapist about maybe increasing the frequency of sessions, hoping it might help with strength, but I'm not sure if that's feasible with everything else going on.
That's a good initiative. Improving your mobility and strength is key to your recovery. We'll discuss how we can support your rehabilitation further. Let's also plan for you to see a hematologist regarding your anemia and possibly a kidney specialist to reassess your overall kidney management and dialysis needs.
That sounds good. I just want to feel better and be able to do more things on my own again.
Absolutely, and we'll do everything we can to support that goal. Now let's go over some of your recent test results to better understand what's happening and how we can adjust your treatment plan. Your last blood pressure reading was 148/90 which is on the higher side, and your creatinine is at 2.4 milligrams per milliliter, with a BUN of 54 milligrams per milliliter. These figures are consistent with your kidney condition but require close monitoring.
Yes, I saw those numbers. What do they mean for my situation?
They indicate that your kidney function is stable but still compromised, which is expected in chronic kidney disease. We need to continue managing your blood pressure aggressively to help protect your kidneys. Also, your hemoglobin is at 9.7 g/m, which is likely contributing to your feeling of weakness.
So what's the plan moving forward?
First, we'll adjust your amlodipine to better control your blood pressure and review all your other medications for any needed changes. I'll arrange for a blood test next week to check on your hemoglobin and kidney functions again. We'll also set up your consultations with the hematologist and the kidney specialist. For your anemia, we might consider starting IV iron infusions if your levels don't improve.
Thank you, doctor. It's reassuring to have a clear plan in place.
Of course, our goal is to stabilize your condition and improve your quality of life. We'll keep a close eye on all these aspects and adjust as needed. Make sure to keep up with your rehab exercises and notify us.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having some ongoing issues that are really bothering me, starting with my eyes. They burn quite a bit, especially after I use the warm compresses and the OCU Soft lid scrubs. I didn't get the antibiotic drops that were mentioned last time. I'm not sure if that would help, but the burning sensation is persistent.
I understand that must be uncomfortable for you. We will address the eye issue today. Can you tell me more about the neck and arm pain you've been experiencing?
Yes, the neck and arm pain has been a daily struggle. It doesn't seem to get better with changing my posture or anything I try at home. I had physical therapy a while back, and it helped a little, but the pain always comes back. It's been tough to manage, and even basic things like turning my head can trigger more pain.
Have you continued with the exercises recommended during your physical therapy sessions?
I try to keep up with them, but sometimes the pain makes it hard to stay consistent. I've been using Tylenol to manage the pain, but it's only a temporary fix.
All right, we might need to revisit physical therapy to enhance your management strategy. Let's also talk about your previous health issues and surgeries. How have these been affecting your current condition?
Well, after my surgery at the L5 vertebra, I've had some limitations in mobility, and I think that contributes to how I sit and stand, which might be worsening my neck pain. Also, with my peripheral vascular disease, I've had multiple stents placed, and I keep worrying about my circulation and whether I might need more interventions.
It's important to monitor that closely. We'll discuss potential further evaluations for your vascular health. Now, regarding your medications, there seems to be some confusion about what you're currently taking for your hypertension. Can you clarify that for me?
Yes, I've been on lisinopril for my blood pressure. I was taking hydrochlorothiazide too, but it was stopped because of concerns about my kidneys. I also take insulin for my diabetes, aspirin daily, and fish oil.
Thank you for clarifying. It's crucial to have a clear understanding of all your medications to properly manage your conditions. How about any recent tests or investigations? Have you completed any that we had discussed in your last visit?
I haven't had the chance to do the carotid Doppler or the neck X-ray yet. I've been meaning to, but managing my daily symptoms has been overwhelming.
We need to prioritize those investigations to better understand the cause of your neck pain and headaches. It's also important to monitor your vascular health, given your history. We'll arrange for those as soon as possible. Now, regarding vaccinations, do you recall receiving the shingles vaccine?
I'm not sure if I've had the shingles vaccine. I had chickenpox as a child, but I don't remember if I received the vaccine afterward.
It's something we should consider, especially given your age and medical history. Preventive measures like vaccines are key components of managing health proactively. Now, let's summarize your clinical findings from today's assessment and outline the next steps in your care plan. Your blood pressure was initially high at 147/88 mm Hg, but improved to 117/66 mm after resting. This is good, but it highlights the need for consistent monitoring and management. Your blood tests show your creatinine is elevated at 1.9 mg/dL, indicating we need to keep a close watch on your kidney function. Your blood glucose levels are slightly elevated with a fasting level of 122 mg/dL and a postprandial peak of 179 mg/dL. Your lipid profile shows your cholesterol levels are high, which is a concern given your vascular disease history. We need to address this aggressively to reduce your risk of further complications. Your urinalysis was normal, which is reassuring. However, your BMI of 28.5 indicates that we should work on lifestyle modifications to help manage your weight and overall health. Your visual acuity is 20/40, which could be contributing to your eye discomfort, and we will ensure you see an ophthalmologist for a thorough evaluation. Given the mild tremor in your right hand and the restricted range of motion in your shoulder, we will include neurological and orthopedic evaluations in your follow-up appointments. For now, the plan is to maintain hydration, monitor your symptoms, manage pain with the recommended medications, and follow up in 3 months to ensure you complete the necessary laboratory tests and imaging studies. We will also arrange for the missing medications and ensure you have clear instructions on their use.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've looked over your blood tests, and there are a few things we need to discuss. Your white blood cell count is higher than normal, which usually indicates an infection or some type of inflammatory response. Have you been feeling unwell lately?
Yes, I've had some fever and fatigue. What does this mean?
It's likely linked to the high white cell count. Your body is responding to something. Additionally, your hemoglobin levels are lower than normal, which can explain your tiredness and could suggest anemia.
That sounds concerning. What should we do next?
I want to start you on some antibiotics to address any potential infection. For the anemia, I recommend starting an iron supplement. We'll need to recheck your levels after a month to see if there's improvement.
How serious are these conditions?
They're quite manageable with treatment. The key is to start treatment promptly and monitor your response. It's also important to follow up with any further tests I might recommend, just to ensure everything is moving in the right direction.
Okay, I'll follow the instructions and make sure to come back for the follow-up. Thanks for explaining everything so clearly.
Now look at question 26.
Today we're focusing on the critical steps for dispatching ambulances in emergency situations. The first step involves the reception of the distress call. Our team assesses the urgency based on the information provided by the caller.
How exactly do we determine the urgency of each case?
We classify calls based on the reported symptoms. For example, cases involving chest pain or severe allergic reactions are given the highest priority and require immediate ambulance dispatch.
And what factors affect the dispatch beyond medical symptoms?
We also consider factors like the caller's location and traffic conditions. Utilizing GPS and traffic updates allows us to determine the quickest route, minimizing response time.
Is there a protocol for communication with hospitals during transit?
Yes, our paramedics maintain communication with the destination hospital to prepare them for the patient's arrival. This ensures a seamless transition from ambulance to hospital care, which can be crucial for patient outcomes.
Now look at question 27.
Let's go over your CT scan results. We've detected a small mass in your left lung. The characteristics suggest it might be benign, but we need further testing to confirm this.
What does that mean? Am I going to need surgery?
Not necessarily. First, we perform a biopsy to analyze the nature of the mass. This will help us decide if it's indeed benign or if any treatment is required.
How quickly do we need to act on this?
It's important to address it soon, but there's no immediate emergency. We'll schedule the biopsy within the next week. After that, we'll discuss the results and potential next steps, whether it's monitoring, treatment, or even surgery, depending on the findings.
Is there anything I should do in the meantime?
Just maintain your normal activities, and if you experience any new symptoms like increased shortness of breath or chest pain, contact us immediately.
Now look at question 28.
I need to understand exactly what happened and how you're feeling to assess the urgency of your situation.
I slipped and fell, and now I'm having a hard time breathing and my chest hurts when I breathe deeply.
I'm going to check your vital signs right now. The symptoms you're describing could be related to a possible rib fracture or a lung issue, like a pneumothorax, which is when air leaks into space between your lung and chest wall.
What happens next?
Based on your symptoms and the initial assessment, I'm classifying your case as high priority. We need to get you into imaging to check for fractures or other injuries and ensure there are no complications like a collapsed lung.
Will I need to stay in the hospital?
It depends on what we find in the imaging tests. If it's a simple fracture, you might go home with pain management and follow-up care instructions. However, if there are more serious complications, a hospital stay might be necessary to manage your condition safely.
Now look at question 29.
Today marks the launch of our ambitious Breathe Easy smoking cessation campaign. Our objective is to empower individuals to quit smoking by providing comprehensive support and resources.
Can you elaborate on the resources available through this initiative?
Certainly. Participants can access multiple forms of support, including free counseling, both in person and online, access to nicotine replacement therapies like patches and gums, and a dedicated app that provides motivational support and tracks progress.
How effective is this program expected to be?
We've designed the program based on successful models from other regions, which have seen significant reductions in smoking rates. Support is tailored to individual needs, enhancing the chances of a successful quit.
What's the first step for someone interested in the program?
Interested individuals can register through our website or by visiting a local health center. There, they can speak with a counselor to create a personalized quit plan, making the process as smooth as possible.
Now look at question 30.
Today's training is focused on recognizing the need for first aid and how to respond effectively. Knowing what to do in those first few minutes can save lives.
What are the key signs that someone needs immediate first aid?
Look for critical signs like severe bleeding, choking, inability to breathe, or unconsciousness. Each of these conditions requires a different first aid technique.
Could you demonstrate the first steps we should take in one of these scenarios?
Certainly. Let's start with severe bleeding. First, ensure your safety, then apply gloves if available. Apply firm pressure to the wound with a clean cloth to stop or slow the bleeding until medical help arrives.
What if I'm not sure what the problem is, but the person is clearly in distress?
Always call for emergency help if you're unsure. While waiting, keep the person calm and monitor their condition. If they're unconscious but breathing, position them on their side in the recovery position to keep the airway clear.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, I'm thrilled to discuss an important and often complex topic in pediatric care, particularly focusing on the advancements and challenges in non-invasive ventilation for neonates and infants. Recent studies have shed new light on this critical aspect of pediatric care, and today we will dive deep into these findings, their implications, and discuss a pertinent case study that illustrates these concepts in practice. Non-invasive ventilation, NIV, techniques like continuous positive airway pressure, CPAP, and high-flow nasal cannula, HFNC, have transformed the management of respiratory distress in pediatric populations. They offer significant advantages over invasive methods, reducing the need for intubation, which carries higher risks and complications. Let's first discuss the physiological basis of these techniques, particularly how they cater to the unique anatomical and physiological characteristics of neonates and infants. Neonates, especially preterm infants, present unique challenges due to their underdeveloped lung structure, high chest wall compliance, and lower functional residual capacity. These factors predispose them to atelectasis and other respiratory issues. NIV techniques like CPAP help by stenting the airways open, improving oxygenation, and reducing the work of breathing. HFNC, meanwhile, delivers warmed and humidified air, which is more comfortable and can achieve similar effects to CPAP with potentially less nasal trauma and greater patient tolerance. A recent randomized controlled trial published in the New England Journal of Medicine compared HFNC with CPAP in neonates experiencing respiratory distress. The study found that while HFNC is less likely to prevent treatment failure compared to CPAP, it was still successful in a significant percentage of cases. This brings us to the importance of understanding when and how to use these different modalities effectively. Let's consider a case study to illustrate this. We had a premature infant born at 32 weeks gestation, weighing 1,500 grams, who developed signs of respiratory distress shortly after birth. The clinical team initiated CPAP, which helped stabilize the infant initially. However, due to nasal trauma and the infant's distress with the CPAP mask, the team switched to HFNC. This switch was based on clinical judgment and the infant's specific needs and response to therapy. This case highlights the necessity of personalized medicine in pediatric care. It's crucial to monitor the infant's response to NIV closely and be prepared to adjust the management plan as required. Moreover, the choice between CPAP and HFNC often depends on the severity of the respiratory distress, the presence of other morbidities, and institutional protocols and expertise. Furthermore, a comprehensive approach to managing respiratory distress in neonates also involves addressing other physiological challenges these patients face. For example, their higher metabolic rate and oxygen consumption, compared to older children and adults, make them more susceptible to rapid desaturation during respiratory compromise. Hence, interventions should not only focus on immediate respiratory support, but also on monitoring and managing potential metabolic imbalances. In the broader context, these discussions and clinical decisions are crucial for developing hospital protocols and training programs. They underscore the importance of ongoing research and clinical trials to refine our understanding and improve outcomes in pediatric and neonatal care. While NIV techniques like CPAP and HFNC have significantly advanced the care of respiratory distress in neonates and infants, their application requires careful consideration of individual patient factors and ongoing assessment. It's a dynamic area of pediatric healthcare that continues to evolve with research and clinical practice. As healthcare providers, staying informed about the latest studies and integrating these insights into practice is essential for improving patient outcomes.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we're diving deep into the intriguing world of interpreting survival analyses in clinical research, with a focus on its application in oncology trials. Let's explore how survival analysis shapes our understanding and management of diseases, particularly cancer, through a detailed case study. Survival analysis is a key statistical method used in clinical trials to estimate the survival probabilities over time, accounting for various factors like treatment effects and patient demographics. It's particularly crucial in studies where the endpoint is time to event, such as time to disease progression or time to death. Let's consider a case study involving a new therapeutic agent for non-small cell lung cancer, NSCLC, a common and often fatal type of cancer, where survival analysis plays a central role. The clinical trial we'll discuss involved two groups, one receiving the standard chemotherapy regimen and the other receiving the new drug, aimed at targeting specific genetic mutations in the cancer cells. The primary endpoint of this study was overall survival, and the secondary endpoint was progression-free survival. The researchers utilized the Kaplan-Meier method to estimate survival functions from the time of randomization until the occurrence of death or progression. In our hypothetical case, the Kaplan-Meier curves for both groups showed a distinct separation, indicating a potential benefit of the new drug. For instance, at 6 months, the estimated survival probability was 70% in the new drug group versus 50% in the standard therapy group. This difference suggests that the new drug could be improving survival. To analyze these differences statistically, the researchers employed the Cox proportional hazards model, which allowed them to adjust for other variables that might influence survival, such as age, gender, and stage of cancer. The hazard ratio from this model was 0.65, indicating that the risk of death was 35% lower in the new drug group compared to the standard therapy group, a significant finding. However, interpreting these results requires careful consideration of potential biases and limitations inherent in survival analysis. One common issue is censoring, where information about some patients is incomplete because they drop out of the study or are lost to follow-up. This can skew the survival estimates if not properly handled statistically. Another consideration is the assumption of proportional hazards in the Cox model, which means the treatment effect is assumed constant over the study period. If this assumption is violated, it could lead to incorrect conclusions about the treatment efficacy. Moreover, in our case study, while the new drug shows promise, it's essential to consider the clinical significance of the survival improvement. An extension of a few months may or may not be meaningful in the context of the patient's quality of life and the side effects of the new therapy. Thus, the decision to recommend this new treatment involves weighing these factors carefully. In practice, survival analysis not only informs about the efficacy of new treatments, but also helps physicians tailor therapies to individual patients based on subgroup analyses. For example, the trial might reveal that the new drug is particularly effective in patients with a specific genetic mutation, guiding personalized treatment plans. Survival analysis is a powerful tool in clinical research, providing insights that guide treatment strategies and improve patient outcomes. As we've seen in our case study, understanding the nuances of these methods allows clinicians and researchers to make informed decisions, ultimately enhancing care for patients with serious diseases like cancer. Thank you for joining today's discussion on interpreting survival analyses in clinical trials. It's crucial for medical professionals to understand these concepts to effectively translate research findings into practice.